It is a hospital unit that many don't see because it's not allowing visitors at the moment.
It is the center, though, stage of the heartbreak local healthcare workers have witnessed during the COVID pandemic.
Well, Deaconess officials gave Eyewitness News' Katie Forcade a tour of the ICU at Gateway.
It's room after room of glass doors shut. Inside these shut doors are patients sick with COVID.
Most of the rooms, almost all the rooms really have ventilators in them. So most of the patients are on life support.
Etched on these closed off glass doors is how many days these patients have been on the ventilators. Some haven't left that room in weeks. Nurses say some of these patients might be so out of their normal mentality, they have no idea what's going on around them. It's something so many medical professionals view daily, including respiratory therapists.
We hit the ground running once we get to work.
They're now on the front lines of an evolving illness.
It's day by day. So you can go in one day thinking there's nothing else we're going to do, and then a miracle happens and they do get better and they do come off. Then you have the ones that you hold out so much hope for because they're young, they don't have underlying conditions, they can get through this, and they don't.
Medical professionals say about half the patients placed on a ventilator don't survive the virus.
It's disappointing because you feel like you work so hard and you throw everything that we know at them to make them better, and you can't. Sometimes you can't overcome COVID.
That's the hardest part for me, is watching the patients get worse when you saw light at some point.
A harsh reality to those trained to handle typical symptoms with respiratory illnesses. These healers say another challenge is not letting the ever-changing coronavirus keep them down.
You can't let that affect your work.
While they don't have all the answers, they do notice a pattern in those under their care in a sensitive health moment.
If you're vaccinated, you don't have much in the way of other health problems, you really don't have to worry about this kind of nightmare scenario being on the ventilator.
The therapists are urging everyone to get that jab in the arm. They say it could be a lifesaver. Katie Forcade, Eyewitness News.